eCARE is a telehealth company that's been around for a little over 25 years now, bringing telehealth into a lot of different settings. We go into the hospitals to help support ICU patients, emergency departments, pharmacies, and also do rounding as a hospitalist program. We also have branched out now into other locations such as correctional facilities, long-term care, skilled nursing facilities, assisted living locations, and schools as well. Typically, if someone calls in, the nurse will call us from the facility and say that they have a resident who is not feeling well. Our nurse will talk with them and answer or ask a few questions, get the answers to those questions so that we have a better idea of what is going on. And then if we've determined we need to pull them up on video, the nurse will wheel a cart right up to wherever that resident is in the facility. So it runs off a wireless. So they could be laying in their bed, they could be sitting up in their chair in their room. Sometimes they may fall in the dining room or somewhere in the building and they need our help assessing them before they get them up. And so they can bring the cart right in there if they need to, wherever that resident is. It's like an interaction just as if you were face-to-face in a clinic. Our clinicians will visit with the resident and the nurse on the other end. If the family is present, we involve the family as well in the video encounter that we're doing. We have capabilities through a virtual stethoscope to be able to listen to their heart and lung sounds as well, just as if we're in the room with them. Is in both rural and urban locations. The majority of our customers are typically rural. They have more access issues a lot of times. So we're able to bring services that would typically be in an urban area such as a Sioux Falls or a Minneapolis location and bring them right into a rural community that might only have a few hundred people living there. It's not often that a rural location has access to the services that eCARE can provide, such as a geriatrician and pharmacist coverage and behavioral health. And so by bringing that into the community, we keep people in their community, we keep families in that community, we're able to help support them in place. So there's return on investment and financial benefits to all involved. The return on investment to a skilled nursing facility or assisted living is the fact that they are keeping the resident in place, and then therefore their census is stabilized, they have people in their beds, they have revenue coming in. There's value-based purchasing scores out there now where CMS is monitoring facilities' transfer rates and penalizing what they pay them through Medicare if they have too many transfers. And so if we're able to help cut back on those transfers, they get those value-based purchasing dollars back. Care as a whole, nearing 30 states and over 400 locations. Senior care is in about 70 locations across 10 different states that we operate in today.